We're now at the stage where we're ready to share our plan for the future. We feel confident that it turns what we've heard, what we've listened to, and what we've worked on into clear intention for NHS Grampian. This is a historic moment for us and for the future of health and social care in our area. One of the things we've all toiled with over many years and in developing our new plan has been the traditional tension between enabling wellness whilst responding to illness. Previously, we've often had the idea that one of these things is good and one of them's bad, and that's resulted in natural swings from one side of the pendulum to the other. So, just how do we make positive steps for a different future? Our new approach is to create a real sense of balance between the two ends of this spectrum. If you ask me what keeps me awake at night, then it's a sense that we have a system that's not sustainable. That's why, at the heart of the plan for the future, we need to create a sustainable system for the next decade. And we're going to think about people, place, and pathways. Three very simple things that underlie all that we wish to do.
The first element of our strategic intent as we plan for the future has to be people. We need to have a different conversation and relationship with the people of Grampian and our colleagues to ensure sustainability whilst also meeting the needs of the population. To live in a fair and vibrant society where individuals are not left behind but flourish, we intend to focus on improvements for all citizens, joining with them in partnership, not only to improve population health, but also to reduce inequalities and ensure timely access to healthcare when needed. Children and our colleagues will also have a specific focus. By giving children in their early developmental years the best start, we help to create healthier, happier adults and families. We also recognise the significant pressures our colleagues continue to face and the resulting disconnection, uncertainty and challenges this has created, particularly over the last 2 years. It is essential that we focus on improving our colleagues' experience because a valued, empowered and thriving workforce will create and lead the innovation that our communities need and that our colleagues richly deserve. That is a key commitment in the plan for the future.
The second element is about places with 3 focus areas: an anchor organisation, our communities and the green agenda. Each of these is linked by our commitment to becoming a more mindful and deliberate partner, working with others to achieve sustainable change for our communities. NHS Grampian is an anchor organisation with special responsibilities in our communities because we are a large organisation with significant spending power and economic impact. We are one of the biggest employers in the northeast of Scotland. We have a footprint in every community and a large proportion of people who live in Grampian interact with us. We are trusted as a brand, as professionals and as people. And we will use these characteristics and the reach and influence they give us to make a real difference.
Now the final element is about creating pathways of care, which are responsive and adaptable so that they can truly meet individual people's needs. Care is currently too fragmented. People don't know how to navigate it or which way to turn, and is often difficult to access in a timely manner. We need to create care pathways that are empowering, built with and around people and families, ensuring people are truly partners in their care. We want to use every opportunity for prevention in all of our pathways, whether that's in primary, secondary or any other of care delivery. We know that access to services is now a bigger issue than ever before, and far too many people are waiting far too long for the care they need. This plan sets out our clear intent to create new, working pathways that are quick, simple and efficient.
We hope you found this brief introduction to NHS Grampian's plan for the future and our fresh approach to people, places and pathways inspiring and want to explore the details further. We're really excited about the opportunities it presents. There's no doubt this is a challenging time and there's loads of work to do to turn our strategic intent into reality. We know actions speak louder than words, which is why work starts now to put in place realistic, achievable, but appropriately ambitious implementation phases for each of the priorities in the plan. That's the critical next step on this journey. We will only be able to achieve these aspirations with your full support and by working together, united in our vision and intent. Whether you work in health and social care for one of our partner agencies or are a member of one of the diverse communities we serve, I hope you will join us on this journey and grasp the huge opportunity this is to create the health and social care system in Grampian that we all want to see. Thank you.